works on a very informal way, which makes it different from making an appointment, from a nurse being in a clinic expecting, having a list of people who are coming by arrangements. The people who come to the coffee morning are also in a different mode. They've come for a coffee and chat with their friends, and they go and see a nurse. So the whole expectation on both sides is completely different. So it's very informal, very impromptu, and what the nurses have been very sensitive about is actually not wearing uniform, coming out into the coffee morning, sitting quietly next to people, talking to them and getting to know them a bit before starting the consultation. A lot of the people who come here are saying things like, well, I'm so glad I've spoken to the nurse because I wouldn't have wanted to trouble a doctor. I think the informality and relaxed approach is working very well.
And the feedback you're getting from people who've used it?
Very reassured, feel listened to, and feel that they can get the help that they need without feeling a burden or a nuisance to anybody. So I think that's very important.
At the moment it's just a pilot, and in fact it finishes in a few weeks' time, doesn't it?
I think there's today, and then next week's the last one of the pilot.
Mm-hmm. And do you think it's something that, if it could be funded, would be useful in the long run?
Absolutely. I think if there was perhaps not so many nurses coming every time, maybe that is very resource intense, but I think if there was a presence on a regular basis, it might actually save money in the long run, because people who come to the coffee morning might share symptoms sooner and share their concerns sooner, get their medication sorted out sooner. So I think, yes, if it could be regular and reliable, it would be beneficial all round.
Mm-hmm. What do you think the community nurses themselves have gained from it?
I hope they have realised. I always think when you're working in a health setting, you're actually working in an illness setting, and it's very easy to focus on the illness and not see how people with these disabilities and illnesses actually live and function with that. And I think that it's a good model to keep in your head, that yes, there are all these chronic conditions, but actually the people are managing, they're getting out and they're taking part in community events despite it.
Extremely good, the ones that we've got, I must admit, and they take time to talk to people, they're doing the job as they are, people love them. But is it sustainable after this period? I don't know. They will be sadly missed.
Yeah, everyone's been saying the nurses are all really lovely and all really helpful, and there's a lot of people saying it's reassuring. The users have said that the nurses have time, like because the GP has so many people to see, but the nurses can see each person individually and assess their needs and do what needs to be done, and refer them on to who they need to be referred on to. Mm-hmm. And it's just the fact, I think, that the nurses have got a lot of time for everyone, and they walk around and get to know everyone individually.
So what's your impression of Chorlton Good Neighbours, having come to it from...
I love it. I think it's great. I think every place should have it.
Would you encourage other students to try something like
Definitely. This? It's helped me to be able to approach people and talk to people, especially from different generations, and I've just learned so much from people.
Well, it seems very popular. A lot of people seem to be wanting to go and see the nurse and talk to them, and seem quite happy that they've been. People are quite keen, yes. And I think it's quite useful for people who are slipping through the net, because then they can meet the nurses informally when they're having a coffee and just have a chat with them and then see, is this person getting the help they need, if you see.
Yes, because, well, what do you think is the difference between that and going to the doctors?
A lot of people say, I don't want to bother the doctor. His time's too precious. And so they don't want to go unless it's something serious. And so a little thing, they might wait till they've got 2 or 3 little things building up before they'd go. Whereas, in fact, it could be something very important, like skin cancer, which, if it's seen, it gets acted on quicker. The hearing aid lady comes once a month, and that is really popular, and she gets lots of people coming, and they've got that in their diary that the first Thursday of every month she's here. So I think in the same way, if they knew the nurse was here, they would use it, yes. No, but I just think the more we can all work together, all the services can work together, the better service it's going to produce for people.
And actually having it where people are rather than expecting people to come to it, is it?
Because some of our people, it's transport. They get a lift here, and it might be the only time they get out in a week. So for them to get a taxi to go down to the doctor is difficult, and they don't want to call the doctor out unless it's serious.
There's always been a distinction between us as a voluntary organisation and any of the statutory agencies. We've been very, very unsuccessful at getting, for example, GPs really involved in what we do. And so to have them come down from the Chorlton Health Centre to come for meetings, to run the sessions, to drop in informally, has really been, I think, transformational for them. And probably the most interesting comment I got from one of them was that I feel like I'm part of Chorlton Good Neighbours now. And that to me is real success, that they feel part of what's going on down here. They go in there, people know them, they talk to them, they've really adapted very well to that. They've not sort of stood on their professional knowledge, they've just been one of the crowd. And I think that's worked really well. The users themselves are seeing absolutely having a view, and that the people who are their friends and supporters and helpers and who are doing it on a volunteer basis are all taken seriously too. And that requires really quite a mind shift on the behalf of professionals that I think is slowly beginning to happen, and this project is a very, very good start for that.
So my name is Gilly Lee. I'm one of the active case managers, the community matron service based at Chorlton. The loud and clear thing that I take away from this is people don't want a talking shop, they want a doing shop. They want us to do things differently, and I hope that we're trying to attempt that. I love the fact I feel part of Chorlton Good Neighbours now, and I don't say that lightly, really. And I think it's when you're welcomed in, and there's a willingness on both sides. You at Chorlton Good Neighbours, you have some fantastic activities, and it's always a little bit of a tension if we're then taking someone away from that, what they're there for. So I suppose one of the suggestions might be that we move from, we don't stay when there's something on, when we're just sat there. That's just not wise use of time either.
You've got various issues of confidentiality, of structures you've got to follow, procedures you've got to follow, where I think we're a bit more flexible, and we see people as whole people who are both getting a service and some care from us, but are also friends. Whereas, in a way, once they become active cases for you, the pipeline of information then closes down.
I think that's where, when I sat with Helen, we highlighted how that might have, how we could work on that. Like, for example, yes, we've received the referral, yes, we're going to take, we're acting on that. So I think that's important. And then there's also the importance of patients feeling that or clients feeling that they have got that confidentiality.
What we've shown is that a relationship between professionals, volunteers and users can work.
Yes.
But it needs other groups too, because
absolutely.
There are care workers, there are social workers, there are relatives, there are friends, all of which have a stake in particular individuals.
Absolutely.
So I suppose one of the things we can be working to is broadening this approach out.
I'm glad you've said that, because I absolutely believe that. I mean, and for us as community matrons, the beauty is that we're generalists. So we are on that page, and actually it's the way forward. So for me, being a generalist is I'm not just focused on going in and doing one thing. And I often talk about patients in which phase they might be involved with, and some of the perhaps not perceived health things that I might get involved with. You know, signposting and working with a client or patient to get their will done because it was impacting on their breathlessness and exacerbation. That's a biggie for me. And how do you explain that? So yes, I see it as part of that one team and breaking down organisational barriers, and I guess I see you part of that team, and I think we're on that journey but not there, and because I think sometimes there's still that trust to be built, because
But the good thing is,
we're on that journey.
We're actually trying to do it.
Yes.
We're not just talking about it. There's an awful lot of talking and not enough doing, and at least we are doing it.
Yeah. I absolutely agree. I think we have to do it, and we fail at certain things and we get other things better, and it's about doing it.
Right, morning Joan.
Morning.
Have you seen the nurse this morning?
Yes, I have.
Yes, and are you able to say how you found that, or?
It was actually, I went in by chance because I got a sore toe, and they're absolutely brilliant. They said you need antibiotics. They got in touch with the surgery. They got all my medication, they talked to them and everything, and got a prescription. But they were so kind and caring. Took the blood pressure, weighed me, all this sort of thing, as if it was a real appointment, I suppose, in a way.
But the beauty of it is you literally just...
Yeah, you're very, very kind, very dignified in everything, and really, really were good. But I am very impressed. I think it's excellent, and we're so lucky to have it here.
Yeah, we are.
Really are.
Yes. Hello. Have you had much dealings with the nurses on a Thursday coffee morning?
Yes, I have.
In what way? Are you able to say?
Well, I think it's a good thing that they're here, because sometimes you have things you would like to ask your GP. But sometimes when you get there, what you plan to ask them, you don't get to ask them. For some reason, maybe you get a bit frightened or whatever. But anyhow, when you have the nurses that come in our Chorlton Good Neighbours, I think it's a good time to speak to them one-to-one, because I think it's very interesting, because like me as a diabetic, I think I go to the clinic as well, but to have the nurses here to talk to and to have a chat with them and explain things to them, and they explain things back to me, it widened my understanding. And I very much appreciate them coming, and I hope they continue to come to help us.